recording. All right. Menstrual disorders, you have amenorrhea, that is the absence and suppression of menstruation. I need to tell you that I create a multiple choice with the following PowerPoints when you have this terminology. And this is one of that terminology and definition that I am putting and I build the multiple choice, meaning pay attention to amenorrhea and the absence or suppression of menstruation. The next one, careful with metorrhagia, careful with hypomenorrhea. I am creating again a multiple choice with these fellows. The next one, oligomenorrhea, infrequent menstruation. Also, polymenorrhea, increasing frequency of menstruation. I love this particular terminology because everything needs to go with menstruation, and it will be very simple and very tricky, that question. Yeah, I love it. Meaning careful with those two. And the last one over here that will be part of that multiple choice is that one. That multiple choice that involves all those definitions are in 2 or 4. Meaning it's a question that half of the class will see. The next one is the famous abnormal uterine bleeding pattern over here. I decided to remove this one out, but this is a newbie. This is a multiple choice. I'm pretty sure that most of the ladies present in the audience have this particular experience, meaning that careful with this one, 2 or 4, multiple choice. You will see this one in 2 tests over there. The famous chart suprapubic cramping severe enough to limit activity, nausea, vomiting, diarrhea, and I just want chocolate and want to see that soap opera that will make me cry. That is a very interesting thing. Let's move on to the next one. Dysmenorrhea, I decided not to put it over here. It's out. But something that I like to ask is for the uterine prolapse. The uterine prolapse, I need to tell you, I saw it. I encountered that problem myself. I think I mentioned this one before in some of the classes. Yeah, I had this scenario in front of me at 2 a.m. in the delivery room when the lady, I basically put the baby out in vaginal position, thanks God, no C-section, but she put too much, and that beautiful uterus also came out after the placenta. Yeah, I need to put that baby for almost 2 hours in that position after the attending show up, and in the moment that the attending is entering to the door, I help the patient to accommodate a little bit better in the table, and that movement that I did to help her out make that the uterus return back inside her body. And in that precise moment, the attending entered to the door and said, "What the hell you called me? I don't see anything over here. Everything is fine." Meaning that was an interesting experience because after 2 hours to have the uterus and the cervix in front of my face suddenly disappeared just to make me look bad in front of the attending. But this is part of the history. Again, careful with this one, also 2 or 4. The uterine prolapse, you have it first degree, second degree, third degree. What I saw was this, meaning you can imagine how peaceful I was on that night. Of course not. The clinical manifestations, I didn't ask you this one. And then we have something very important in the ladies that we need to take care, is the famous pelvic inflammatory disease. And yes, this is a multiple choice, 2 or 4. And all of there is basically what can create this particular inflammatory disease. Could be an inflammation cervix, in endometrios, in oviducts, in the ovaries, even over here in parametritis over there. That is the connective tissue that involve all the other structures over there. Very important indeed to go through that. The common organism, somebody can see a true or false with this one, but it's just one question. It's very important that you remember that. Moving on. The pelvic inflammatory disease, the clinical manifestation, I don't have to tell you, but you can assume pelvic pain, always one of the main situations over here, and the tenderness in that palpation. But I will not ask you for that. The same thing with the treatment, out. I need to tell you, if that person have a pelvic abscess, that is very bad, very serious situation, because if that particular huge amount of pills start to move away with the infection, can create a sepsis, and after a sepsis, you know what will follow, a DIC that we mentioned in the previous test. But again, I will not ask you this. Vulvovaginitis is in the inflammations of the vulva and the vagina. I saw something similar to that a long time ago, not a pretty size either, but was more because the obstructions of the glands that the lady has in the vagina. But I will not ask you this one. You have some manifestations over there, but I will not go with this one, or I will not go with this one. Now, the Bartholinitis, yes. This one, I have a little bit of care with this fellow because this is the gland that is basically located in the vaginal orifice and can lubricate the vaginal introitus over there. The problem is we have a bad hygiene, and these fellows became obstructed and create an abscess exactly like a tiny abscess that you have like a pimple in your face. The problem is it's almost 5 times the one that you have in your face. And it's very interesting how the inflammation goes because all that area of the labia majora became like a cookie jar of inflame that you will see over there. The ladies walk like a cowgirls because they cannot close their legs because the inflammation is so huge in that area. I had the opportunity to deal with this particular scenario. I received the order to basically to drain the cyst. But honestly, do you think that I would put a hand in an area that is so sensitive and squeeze an abscess? Of course not. I told to the patient I will not do that unless that I can see the opening of that particular abscess. I never saw it. I sent it home with the condition to return back to my attending office to do that. She asked me to go to the restroom. She dried out herself, and when she was drying out herself, she basically burst the opening of that abscess. She came back to me and said, "Hey, I think that I found it because I have a little bit of blood and pus and pus over here." In that precise moment, I start to squeeze almost half a liter of pus and blood from that labia majora internally in the vagina. It was amazing. I never saw so many pus in my life coming out from there. Yes, yes, yes. It's smelly like hell. It was a sugar crush, delicious kind moments over there. But I need to tell you, as soon as I remove all that infection from that labia majora, the lady fell 360 in the sense that she was walking normally without pain because I drained all the infection from that place. And let me tell you, it's to like to close your fist and having in the middle of your legs, and suddenly the fist disappear from out of the middle of your legs. In that kind of a scenario was how inflamed was that area. One of my very successful treatment that I can imagine, but that was squeezing all the way inside of the vagina, just to give you an idea. Moving on over there, I don't want to remember that because I want to sleep well tonight. This one is coming. No, it's not 1 of 4, it's 2 of 4. Uterine leiomyomas, 27, no, 27 is there. It's a true or false. 1 of 4. It's a true or false. The uterine leiomyomas, very important indeed, because this is what happened with some particular gynecologists here in South Florida. You have a sudden bleeding, a uterine bleeding, and then they suddenly will tell you, oh my God, we need to check that for cancer. Oh my God. I hate when the doctors and some nurses do that kind of assessment without the proper examination and the proper biopsy, because the majority of these bleeding is because these fellows. And 50% of all the premenopausal women will pass through that, and some older than 35 can pass through that. Meaning, the majority of those bleeding that the lady could have in the uterine way is because these fellows, and they are benign. But when they don't tell the patient that kind of information, they scare the patient thinking that they have a terminal cancer over there. And I am a little bit, let's go down to earth. Let's start to eliminate the good thing first before we go to the bad things later. That is the reason that I want to make this multiple choice 204 to remind you that even that look bad, not necessarily is the bad thing. Okay? Careful with this. Moving on to the next. Forget about this one. The problem with the leiomyomas is that the vaginal bleeding and the discharge that can create pain. Probably you hear that particular situation. If you already have all the babies that you want to have, then we go for the hysterectomy and we resolve the problem forever. But you still in the moment of fertility, basically want to have babies, I will not do that until you decide. But if you want to leave this particular problem out of your life and you already have 4 kids, put it away and resolve the problem once for all. The ovarian cyst, I didn't ask you anything about this one, even that I was so tempted to do it. But this is one also very painful indeed, because when the cyst bursts over there, they can put that fluid inside of the abdominal cavity and create a huge amount of pain over there, and also came and go depending the stage of your beautiful cycle or the menstrual cycle. But I didn't ask you anything over here, meaning this one is not. Endometriosis, yes, this one always is come, 204. You already know that this is an increased risk for ladies that never have a baby or never have been pregnant, and any lady over 30 to 40 years of age, meaning that endometriosis are very prevalent in this particular population. Is benign, obviously, but the problem with this tissue that's supposed to be inside of the uterus is that came out because they're supposed to be inside of the uterus. It start to came out and then start to grow with the changes in the menstrual cycle, creating some kind of pain and discharge over there. Meaning multiple choice 204. You have some etiologies over there. I will not go with this. Endometriosis, that is the problem with this one. Once it's implanted over there, can create that bleeding and a huge amounts of pain. A problem over here is the fibrosis that could follow because this particular tissue is in the fallopian trunks over there, can promote the sterility because don't allow the eggs to pass through the fallopian trunk. But again, out. The manifestation, you have the pain over there. I will not go with that one. I will not go with this one either because it's the treatment. And then we enter to the cancer. The cancer is there. 1 of 4 in this case, multiple choice. You already have the cancer over there. The next one, yes, okay. This particular one, I did a tiny spaghetti with this one, with the next one, meaning these two create part of that question of cancer in the cervix, meaning careful with these two because there is like a 3 variants in this question. There is this question only, there is the mix, and there is the previous one alone, meaning that you have 3 questions from the same particular topic. What is basically the advice? Make sure that you know those both particular slides over there, okay? Those two, the mix. In the treatment, forget it about this. The prevention, you already know that we have a vaccine because HPV is very related to this cervical cancer, but I didn't ask you for that one because I didn't have the time. This one out. But then I have endometrial cancer. Endometrial cancer is also another question and include this particular bullet, 104, and include the next one. Here I decide to include a little bit of treatment to make the question more interesting. But it's one of four, meaning previous and this one make the question. The next one is important too. Yeah, I didn't leave this one behind either. Ovarian cancer. Careful with this one. Multiple choice, 2 of 4. You have the clinical manifestation. I remove this one out. The treatment, this one is out. And then we have the vaginal cancer. There is only one question. 1 of 4. See, I basically try to go with the most prevalent cancer that you can find in the hospital and give you an idea what's going on. That doesn't mean that the other cancers are not present, but this is basically what you will see more in a clinical setting in gynecology. The treatment, I didn't ask you for this one. The cancer in the vulva is another cancer, but look over here. The mortality rate is 1.3 for 100,000, meaning that is a little bit rare. That is the reason that I didn't ask you for this one. That doesn't mean that it's not out there, it's there, but it's very rare indeed. That's why I didn't ask you this one. Yeah, I didn't ask you this one either. Now, something that I always like to ask is the famous pregnancy-induced hypertension that more or less you already know what it is. The famous eclampsia. This one is 2 of 4, multiple choice. Remember that this could happen in any particular moments of the pregnancy, and this is the reason why if you are pregnant for the first time, remember to double check your blood pressure baseline in case that the blood pressure increases. You a few millimeters of mercury can make the difference, meaning that we need to pay attention. If you see that your beautiful food start to become water balloon legs over there, make sure that you will basically grown to make the urine test, because as soon as I see protein in the urine, we already have a problem in the kidney, and it's in consequence of that increase in the blood pressure. Forget about this one. Forget about this one. Forget about this one. Basically, that the last one I was basically cutting out. Epidermis ingravidum is the famous morning sickness that we have in some ladies, but in extreme cases scenario because they are excessive vomiting. I didn't ask you this one, but this is something that is very prevalent over there in the ladies that are first mama for the first time. But I need to tell you, to the mothers to be, every pregnancy is different. Some pregnancies are like the Son of God coming over there. They don't bother you for anything. But there is some pregnancy that look like the son of Lucifer and make you life miserable since the day one. Meaning that every pregnancy is very different indeed. And one of the scenarios is this one over here. The mother that is vomiting, vomiting, vomiting. I saw, yeah, this is true. I saw mothers in the 4 months of pregnancy just to watch her husband coming inside of the medical room, and she started to immediately vomiting just to see the faces of their husband. That is an incredible thing. I don't know what happened over here. I don't know if it's the baby that don't like the father or is the mother in reality. Moving on over here again, this one is out. Placenta previa. Yes, the previa. Now this one is in. It's only 1 of 4. Very common complication is because the placenta is implanted near the entrance of that uterus. And this is a problem because that can create huge amounts of maternal hemorrhage and can interrupt the fetal oxygen supply. That is the reason that we need to be extremely careful with this case scenario, because they can lose the baby. In some cases, the predilections over here is that we need to go by C-section to make sure that we don't have any kind of problem. That's why it's 1 of 4. The abruption placentae is another one, but I didn't have the opportunity to ask for this one. Is out. The spontaneous abortion, this is another complication we have, also called miscarriage. What I need to tell you about miscarriage is the following thing. Normally, the nature is very wise. If there is a product in the mother's womb that is not completely compatible with life, the pregnancy will stop. Meaning the reason miscarriage happens most of the time is because the product is not viable at all. And that is the reason that the pregnancy stops. Now, if you are pregnant and that pregnancy past the 12 weeks, there is nothing that will stop that pregnancy to the full term. The majority of the problems that a baby could basically pass through or the mother can pass through the pregnancy is in the first 12 weeks. If everything passes without problem in those 12 weeks, prepare yourself that you will be a mother no matter what. Okay? That's the only thing that I will tell you about that. But I didn't ask you this one in the test. It's out. This one is out. The famous fibrocystic breast disease, this one is for the final test. I didn't have opportunity to ask you for this one now. Meaning, final test, I will ask you for this one. The same thing happened with this final test because I will do two of those slides. This one is out. The benign neoplasm fibroadenomas also in the final test, final only. Cancer in the breast, yes, there is one question about this one. I cannot let this one behind and probably I will put it in the final test again. Careful with this one. Reaching the end, out this one, out this one, go away, out this one. The pathogenesis, I have something for the final test. This is final. True or false in the final. So you see over here the different kind of survival rates. See, there is no lymph node involved, but see, there is lymph node involved with distal metastasis. You see how much the rate drops over there, just 25%. This one, no. And the treatment, this is for the final test only. Reaching the end over here, no this one, no this one. Okay, basically that is all for chapter 33. Didn't reach 9 o'clock, meaning that it was a good time frame. You already have more or less what you need to know for your beautiful quiz next week and some previews about your final. Meaning that be prepared for next week. We basically reaching the week number 6 and we almost there at the end of this class, meaning that prepare yourself. Now it's becoming interesting now, okay? Good night to everybody. Good luck to everybody of you, and bye-bye.